And here we are. Dr. Crook joining us from Hawaii. My name is Josh Rubenstein. I'm the media director for Kaiser Permanente, Southern California and Hawaii. And you are joining us from Hawaii right now on this Doctor's Day. And
Yes.
first of all, thank you so much. You have an incredible story that we really want to understand and hear about. And your story of becoming a doctor began overseas.
Yes, thank you so much for having me here. I'm Irina Crook. I was born Irina in Kiev, Ukraine, and I don't know why I wanted to be a doctor. I surprised my family with this revelation after I went to sleepover with other three little girls, and I just came home and I was about 13 years old, and I said, well, I'm going to be a doctor. My family, my mom was in research. She was an MD. My grandmother was veterinarian, and they sort of did not object and did not really argue with that. And I always loved biology and physics and chemistry, and it was a natural path for me to enter Alexander Bogomolets Kiev Medical University, or Ukrainian Medical University now, in Kiev, Ukraine.
I have to say that it must have been some sleepover that you came out of that wanting to be a doctor.
I
What
know.
did the other two girls go and do?
Yes, well, so the other girl, she wanted to be a doctor as well, and then
Oh,
she became a teacher of French. She sort of betrayed the profession, and the third girl wanted to be a teacher, and she actually became a very successful teacher, and she's teaching Russian in Prague, where she lives right now. So two of us kind of stuck with our choices.
So you went to med school in Ukraine.
Yes.
Tell me, what's it like being in med school in Ukraine? I assume it's similar to being in med school here in the States.
So I had a great medical school. This is Ukrainian Medical University, and it was a 150 years old building with this auditoriums and beautiful labs. And we had a lot of international medical students from Eastern Germany and from Africa and from different parts of the world. It was a big faculty. It was world renowned. It was in Kiev, actually, where it was born, near the zoo. And when we skip classes, we just go to zoo with our projects and like work on our anatomy little things there with our skulls and scare people. I had a privilege to uh, just connect with my colleagues, and we stayed in touch all these years. We had reunions. We stay in touch with very close group of people. Uh, all of us were able to do very well. Was able to come to United States and take all the exams and become a doctor here. My other friend from my group, she's in Harvard doing genetics. My two other med school friends, they both world-renowned neurosurgeons. So Ukrainian medical school was great. We also studied in Latin. So when I came to United States, a lot of terminology was already there. So this was my experience, and it was free.
Oh, there you go.
Mhm.
What got you to the United States?
That would be a Texan named Ron Crook. So this is how the story goes. After graduating from medical school, I decided to study cardiology, and I entered this program which I applied for, which was training in Paris, France, to do invasive cardiology procedure. As you remember, stents and balloons were very new at that point, just were introduced, and it was 90s. And I am just walking in the Paris metro, and there is this guy who could not speak a word of French. And at that time, it was very difficult because in France, they did not really like to speak anything else on purpose. And so I helped the guy, and we stayed in touch. And long story short, he invited me to visit him in California, where he lived at that time. And we continued our journey together now for 29 years.
So you married 29 years. You married a Texan who lives in California,
Hmm.
but you made one more stop, which is
Hmm.
where we're talking to you from. How'd you get to Hawaii?
So when I married the Texan who lived in California, Barstow, California, in Las Vegas, from all
The
places.
geography lesson. I like this. It's
Yes,
all over.
exactly. See, I move around. So with this Texan, yes, we did went to Las Vegas one day, and what happens in Vegas? So
I,
he motivated me to take medical exams and do another residency, which was a pathway to becoming a doctor. And he said, if you take your tests and get the residency, I'll take you to Hawaii for vacation. As I did that, I said, okay, pay up. And he takes me to Maui, Sheraton Maui, my first time in Hawaii. And I walked in this ocean and this breeze and this beautiful flowers. And I told him, I am moving here. And he laughed. And who's laughing now?
yeah, that's right. Because you're there. You're still there. How long have you been
I'm
in Hawaii?
still there. Hmm?
How long have you been in Hawaii?
Since 2005.
2005. So
Yes.
you're a native there now. You've been there long enough
Well,
that
I came for 3 months, and one of the jobs was actually with Kaiser. I was in the local clinic, and I'm still here.
I love it. What is it about Kaiser Permanente medicine and that drew you into Kaiser Permanente in particular?
Um, since I worked in Kaiser in different capacities, I have noticed how this system is great. This is the best system I worked in. And I worked everywhere on the islands, and I worked a lot in different settings in Texas and actually when I was a resident. So the main advantage of Kaiser is how connected inpatient side to outpatient and primary care to subspecialist. We have very close knit culture. We talk to each other, we listen to each other, we're doing the best for the patient, we all contribute, and we're like a medical home. And I have not found that in any other system. And it is very easy to get support, like a technical support, or you need a lab. And it's very benign culture because I'm just talking to my colleagues. I can talk to them on a chat. I can talk to them personally. We know each other and we spend time together because how close everything is here. But we also meet in each other in different settings. And it's just the best for the patient when you have a good communication between different providers. I haven't seen anything like that in any other system I worked in. And also, I'm now a hospitalist. I did not pursue cardiology here, but I am really enjoying having this collegial time with my colleagues and my friends. Honestly, anything happens, we'll talk to each other. We're on difficult cases by each other. Somebody is holding my beeper now when I'm talking to you. So this is actually a system I really enjoy working. I love my job.
It's that integrated care that you're talking about.
Hmm.
What Tell me what the joy you get about being a doctor.
So when I first started, when I was a young doctor, I thought I know how to fix everything, and now I know that we don't. But it is that patient who is walking out of this hospital after a month of hospitalization and being near death. It's like having this gratitude, having this connection to patients and their families, having this privilege to be with people in the most difficult time of their lives. Um, I really, really like that patients remember my name now. And they would stop you on the street and I say, Dr. Crook, do you remember me? And actually, I remember you. And talking to the families and praying with them for the patient's recovery and hugging them after patient get better and hugging them and crying with them after they didn't. This is a privilege to be that important person in this patient's life in their hardest time.
Is it okay to have an emotional connection like that to your patients? I mean, sometimes when you deal with tough things all the time, you have to put on some kind of a tough exterior to deal with it all the time. But you say you do get an emotional connection.
I do, and it's hard not to. I do have the time when I turn off and I have the self care regimen, which is meditation and exercise, and Argentine tango dancing. When I basically decided that I would be present 100% at my work. When I go home, I am present 100% at home. And with Kaiser, it actually let me do that. This kind of job, Kaiser focuses on quality of life for their doctors. That's why there is longevity here. And yes, I would get emotional connection with the patients because I feel for them. but I'm also understanding. I know how to preserve my own core, and I know how to stay strong for everybody.
Well, in staying strong for everybody, that brings up a very tough part of this conversation, and that is what's going on in the land where you grew up. First off, tell me what it has been like the last month watching the images from Ukraine.
It was something I was hoping will never happen. It was unimaginable when it did, but to tell you the truth, I was afraid it might happen. I have my mom, who is 81 years old, and my sister. They lived in Kiev all their life. Even as I moved to United States, they always wanted to just live in Kiev. And we meet about every year or every few years with pandemic somewhere in Europe. Our last trip was in Budapest, and this year we were planning to go to Amsterdam and to see tulips in spring. As the things unfold, and as I was afraid for their safety, I was urging them to leave, but they declined anything that they just didn't believe me. I arranged for them to place to go, but they did not leave until that last day. And they actually left to be in western Ukraine near Carpathy Mountains just because I was asking them and crying and pleading with them to just make me to calm down. When the invasion started, it was unthinkable. I still wake up and I think that it is a bad dream. It is like one of these apocalyptic movies. It is hard for me to process, and when I go home, I don't look at the news every night because it's too hard and I can't sleep. Since then, I got in touch with my family, and they now across the border in Poland. And I am planning to go there and find some more permanent situation for them to be in. I'm also in contact with my colleagues from my medical school. Again, the unthinkable, when we were talking about it, they were making some preparations. Nobody really believed it could happen. But all of them stayed behind there. There is neurosurgeons, two of them. There are surgeons, there is endocrinologists, there is dermatologists. Everybody that I know are in Kiev working and helping people. And I feel it's my duty to help them as well.
Do you know the house that you grew up in, the town you grew up in? Do you know if it's been damaged?
It's still standing as far as I know. But, there is shelling every day. There is army near Kiev. And if they go, it would be Mariupol. I pretty much thinking that Kiev will not be livable for a long time, and my family cannot return. My mother and my sister actually very much preoccupied about that. Every time I call them, they say we think it's still standing, and my mother was very preoccupied as how she can come back to Kiev if the bridges are blown. They were thinking going back there even as the war unfolds. They are not really believing or feeling that they cannot go back.
I can't even imagine what how difficult it must be, and how difficult it must be to be so far away from them and see everything and try to manage from afar. Um, I can't. I just assume it's just heartbreaking all the time for you.
It is, and they are not in good place right now. They're both crying, and basically we are talking about what they are going to do, and I am going to help with their relocation as they don't have a visa to come here right away, but I will help with their temporary arrangements and then we will see what we can do. And I can tell you that the only solution they would be happy with is to come back to Kiev to their lives. And I don't know how much possibility of that is existing, but I told them one day at the time, I'm sending them a little bit of money to just get by, and I'm going there on April 2nd. I have commitment to work on the border first, and because there is a lot more, it's so much bigger than my family. There is three
Well,
and a half million people now.
yeah, you're not just going to take care of your family. You're going to take care of the thousands, the hundreds of thousands the millions that are there right now in this humanitarian crisis. You're going to go help, aren't you?
I think I'm well equipped to do this. I trained in internal medicine, but I worked in emergency room before. I speak Ukrainian and Russian, other languages. I've been to the crisis situation when Chernobyl happened. I was 21-year-old student, and I was in that situation. We were in Kiev. Students went to help with multiple people displaced, arriving to the hospitals, radiation, and I know how it is, and I know how to be useful. And I think I'm one of the people who would be useful there. So yes, I made arrangements.
So, and I just want to, I don't want to jump over what you just said. You were there, working when Chernobyl happened, that disaster, and I assume that was a disaster beyond any kind of an imagination. And here we are again, another kind of crisis beyond our imagination. What was that like at that time when you were?
So it is unfortunate. I was 21 years old. I was a medical student. We just started our clinical medicine, and we were tasked with different areas. It was in a 30-kilometer zone where evacuation process began. Men went in deeper, women stayed on perimetry. We just helped with what we could, with screening people. We were helping with different medical needs, what we could do. We helped to allocate people with their shelters. And it was just this unimaginable situation when thousands of people were displaced in a minute's notice. It was an organized chaos, and it was very hard, and it probably something I refer to that we survived to help me in these situations. And now I feel crisis is much deeper, and it actually keeps happening as we're talking, and more people will leave their homes and will be sick, and it would be cold. It would be no plans, no nothing for future, nowhere to go. And even if you just go there and give them the warm meal and word of encouragement and something to get them by, that is appreciated. And I also can help with medical needs. People come in with hypertension and anxiety. One of my former residents is on a station in Meduka there. He's telling me it's just a lot of people and a lot of just maybe problems with, you know, hypertensions and heart attacks and anxiety and need antibiotics, have fever, and COVID as well. So I think I
Yeah,
would be
we don't even
useful
think
there.
we even like you just brought it back up again. Like I didn't even think about it. Like they're dealing with COVID as well, and they're all being crowded into small spaces. The worst thing for COVID, right?
Unfortunately, yes, and I don't think we have much resources to deal with that in the refugee camps. But I think that would be one of the problems too, to figure it out how to address.
What you had mentioned that you have to make preparations yourself. It's not like you're going to be going to check into a nice hotel when you get there. You have to take care of yourself when you get to Ukraine. What kind of plans are you making?
So in my preparation, I understand that you may be going somewhere with no infrastructure. So I have my tent, I have my water purification system, I have my jet boil stove, I have my sleeping system with, my sleeping bag and underneath inflatable things. My camping gear is coming with me. And in the past 2 years, as COVID was in that way something to develop some skills you never had, I actually developed the outdoor camping skills, and I can certainly hold my own there.
What what would you tell people? What do you want us to know? What do you want us to do? Um, everybody who's watching this from afar.
I want you to know that there is a greater need and greater need is coming. And I really appreciate when Kaiser rallied up and donated to all the charities. But I think that I am really worried that the need would be there tomorrow and the next month and maybe the next year. And news about war of Ukraine will become this noise, this background, another woman in Ukraine. And it is a need which is really in my heart. It is something I see with pain people exiting their homes. And I think I pray that war will end tomorrow, but it's not. And even if it ends tomorrow, many more people will need shelter and food and medications. My friends sending me this picture of lists they taken what they need in supplies, and supplies are consumable resources, and we will need funds for that. So I really appreciate that Kaiser had that drive, but I want to tell people, don't stop. Please donate to Ukraine. Please help Ukraine.
Yeah, and you had mentioned that sometimes when these things drag on and on and on, people start forgetting about what's going on there, or at least they put it to the side. And I think you would say, make sure that we continue to remember and know what's going on there, right?
I would like that. I understand that we live in the era when news are mostly negative, and it's very hard to live in this negativity. But this is a real need. This is real people. This is people like me. This is my family. This is not only my family. This is families of my friends. This is my childhood friends. So I think that we will need the resources which anybody can get, and it's easy to donate, and we will use them to help people, and it's really really means a lot to me, people helping other people.
I think everybody gets into businesses like this, whether it's healthcare or um, because you want to change the world. You want to make the world better than the way you found it. And you certainly are doing that on so many different fronts, from your work in Hawaii at our medical center there and to the work that you're going to do when you go to Ukraine. What is the one piece of advice that you would give to a young student who's saying, you know what, I'm thinking about becoming a doctor? What would you tell them?
I would tell them that this is a great career path with a lot of sacrifices, which in the end of it is worth it. I would tell them that you may miss a lot of weekends and family gatherings and basketball games with your kids, but in the end of it would be somebody's life you save, and some family will remember you. And it is a great profession which makes a difference, and your life would be worth it. But you have to have perseverance, patience, and also self care.
Thank you so much, Dr. Crook, for spending time with us. We will be with you in our hearts in Ukraine. We wish only the best for you and the safety of your family and the safety of your health there in Ukraine. And you are a wonderful example on this Doctor Day.
Thank you so much, and thank you for listening. And please remember Ukraine and stand with Ukraine.